Welcome to Holistic Kid Show. My name is Zane.
And my name's Abdullah.
We're the Holistic Kids, here to educate and empower us kids from the inside out. With most of us kids remote learning from home, we know this time is no other but everywhere you turn. There is fear and stress, but have no fear. Dr. Tiff is here to take that fear and turn it into empowerment.
Dr. Tiffany Jumaily, or Dr. Tiff, is a board-certified pediatrician and a fellow of the American Academy of Pediatrics. She completed her pediatric residency training at the prestigious Ivy League program at Brown University in Providence, Rhode Island. Dr. Tiff works to identify and treat the root cause of symptoms, as well as the presenting manifestations of disease. She believes that overall wellness is built from a strong foundation in several key areas. She combines evidence-based allopathic medicine with complementary and alternative therapies to support her parents and help them thrive, and everyone else's. Thank you, Dr. Tiff, for joining us today.
Thank you so much for having me. I'm happy to be here.
For the last few months, we have heard about one thing in the news. Do you know what that is, Zen?
COVID.
Or the coronavirus. What is it, and why are people so scared of it?
So coronavirus is a broad category of viruses. It's a family where there's lots of different types of coronaviruses. And many coronaviruses are circulating in the community every year. And usually they give us colds. They give us some runny nose, a little congestion, maybe some coughing. But this one is different. The reason COVID is different is because it's more, it's changed from the others. And so our bodies don't fight it off as easily. And so it can make some people very sick. And that's why it's so much more concerning than any other coronavirus that we see every winter.
As a practicing pediatrician, are you seeing a lot of kids getting sick from the virus?
We have been seeing some of our patients getting sick and being tested positive for COVID infection. But luckily with kids, they're not getting as sick as older adults and elderly people or people with chronic illnesses. So thankfully, the kids we've seen in the office have had very mild symptoms. So thankfully, it's not keeping them down too much.
What are the symptoms the kids present with?
So it can vary a lot, and that's part of why this is so difficult to catch. A lot of kids have very mild symptoms, so maybe just feeling a little tired, a little run down, maybe a little bit of a runny nose. Also fever and cough can be common. But sometimes kids don't have any of the respiratory symptoms at all, and they have something like stomach symptoms. They can have vomiting or stomach aches or diarrhea, which can still be, COVID. And pretty commonly, people can lose their sense of smell or sense of taste. So sometimes that can be the only thing that shows up, where all of a sudden, my breakfast doesn't taste the same as it usually does.
So how can kids know if they have it? I mean, all these symptoms look just like the fever. Is there testing they can do? Which one is more accurate for kids?
So absolutely, there is some testing. The most accurate one is called a PCR test. And that's where they take a little Q-tip swab and wipe some of the mucus from inside your nose and send it off to the lab. So this one is called the gold standard. So this is the test that they kind of use other tests up against. It's not perfect, but it's the best one we have. The problem with it is it takes a couple of days for the results to come back to get this accurate test. So some doctors' offices offer more rapid tests where you can get results in about half an hour. And sometimes that's done with a little blood test from your finger or also a swab from your nose, depending on what kind of test it is.
This virus has also hit our family hard. My mom's aunt and uncle just died with COVID complications.
So sorry.
What are the complications of getting the virus in kids?
So like I said, most of the time in kids, the virus is pretty mild and doesn't have a lot of complications. However, in some cases, kids can develop something called multi-system inflammatory syndrome of children. And this is where the inflammation that goes on in the body to fight the virus kind of gets out of control and can cause a lot of damage in the body. So it can present in different ways, but it can affect, organs like the heart or the lungs or your brain or intestines or kidneys or even your eyes or skin. The good news is if these things are coming up and you get checked out by your doctor, kids do very well with medical care. Often they have to go to the hospital for a couple days and get some medicines and IV treatments, but they tend to do very well. So it's not as scary as it might sound.
My mom's cousin had COVID and now is dealing with chronic fatigue, shortness of breath, joint pain, chest pain, brain fog, and palpitations. After the bout with COVID, my mom says that is long haul syndrome. What is long haul syndrome, and does it affect kids?
So long haul syndrome is the term to describe lingering effects that can happen after COVID infection. So with COVID, sometimes these symptoms can be things like fatigue or cough that lingers, but also some people will have ongoing chills or body aches or headaches or even brain fog where they feel like they can't really think clearly. These symptoms happen after COVID infection, and oftentimes it happens after people are feeling better. They have COVID, they're sick for a little bit, and then they start to feel better and come out of it, and then all of a sudden, these kind of symptoms come back. When they've done studies in France, they think about 10% of patients after COVID develop these long haul symptoms. And it's kind of unclear, how long they last or why COVID is giving these symptoms and not other colds. But thankfully for kids, it seems like kids aren't affected very much. The average age is about 40. So kids, I don't think need to worry so much about the long haul complications.
So now let's talk about what we can do as kids. We know lifestyle choices are important to optimize our immune system. But what can kids do specifically daily to prevent getting this virus?
Yeah, that's a great question. So the best thing we can do is to protect ourselves. So, avoid getting exposed. So with COVID, that means, trying to avoid being around a lot of other people, wearing your mask when you are in close contact with people like outside or, in the store, and washing your hands frequently. Kind of preventing these exposures is your best bet. But that being said, we can all take lifestyle choices and steps to keep our bodies as healthy as possible. There's a couple things that we can really do. The first one I want to talk about is sleep. Sleep is one of the most important things we can do to help keep our immune system strong. And interestingly, when they do studies, the immune system gets impaired with lack of sleep before we feel that lack of sleep, before we feel that fatigue and that being tired and thinking like, oh, I'm not getting enough sleep. So it's really important that we're getting enough sleep even before we start to feel those effects and feel tired. The other interesting thing about sleep is that the hours that you're sleeping during the day or during the night really matter. So your body gets the most effective sleep in the earlier hours of the night, so between about 9 p.m. and midnight. So it's important to make sure you're getting to bed early and catching those great restorative sleep in those first few hours, because it's not the same if you stay up really late and then sleep in late in the morning. You don't get the same quality sleep that you would if you went to bed earlier in the day. So that's important. Another one is exercise. When we exercise, our bodies build a stronger immune system and we get better blood flow to kind of clean out, the lymphatic system and the blood vessels and, help us really restore and get sick less often. So that's important to try to get outside and get some exercise. Another big one is diet, the foods that we eat and put into our bodies every day. So a big thing is inflammation. Some of the foods we can eat can cause some inflammation in our bodies, which can impair the immune system. So it's important to make sure we're limiting those foods. Those are things like really processed foods, foods that are really sugary and kind of junk foods. And those can really, impair the ability for our white blood cells to fight off infection, to function properly. And it's also important that we're eating lots of antioxidants. So foods that are like fruits and vegetables, because they help fight off the damage that can be caused from the environment, from stress, these oxidant damage that can show up and wreak havoc in our body. These antioxidant foods can help combat that and balance things out. And it's also important to make sure you're eating foods that are directly anti-inflammatory. So things like fatty fish and avocados, things that have those good omega-3 fatty acids in them. is really important. So yeah, those would be my starters.
That's some amazing advice. We try to do those daily.
What food should we not eat?
What food should you not eat? So it's important to try to limit eating a lot of processed foods that have a lot of chemicals, foods that are made in factories, like, chips, or like frozen dinners, like things that have a lot of, added chemicals and preservatives, and they can like live on the shelf in your cabinet, for years and years. A lot of these things can cause a lot of damage because these preservatives also linger in our bodies. And things that have a lot of the excess sugar and processed sugars not only impair our immune system, but they help facilitate the growth of bacteria and fungus in our body. So it kind of does both things. It makes your immune system weaker and it makes the bacteria stronger. So it's important to try to, limit eating those things when we can.
Kids are eating a lot of sugar. Why is sugar not good for our immune system?
So when they've done studies and they have cells in a petri dish, in the lab, and they give them higher levels of sugar, to simulate having higher blood sugar, the cells don't live as well. And sometimes they even die because they're not used to living in those higher sugar conditions, and they can't release the factors that they need to release to function as well as they can. So it's important that we're monitoring, like what they do in the lab can be very similar to what they do in our body. And as much as your body tries to clear out the high blood sugar, with insulin and remove it from your blood vessels so that the cells aren't exposed to these high levels of sugar for long periods of time, they can still, have that transient period, and that can really affect how well the cells work.
Wow, that's such an interesting like lab results. So we have holidays coming up. What should kids do to optimize their immune systems during the holidays?
So, there's a lot of things we can do. We can talk first about stress. Stress is great for an acute event, like something quickly you're trying to, run away quickly, or hurry, I need to study for this test and really focus hard for a few minutes. But it's not great for our bodies to be under chronic stress. And I feel like a lot of us, especially with anxiety and worry about COVID, we can kind of feel stress all the time. And that's really hard on our bodies, because when we're stressed, the body releases adrenaline and cortisol, these hormones that make us this hyper alert and hyper aware and, ready to make decisions quickly. But if these hormones stay elevated in our body, they can also create more inflammation, which impairs the immune system. So it's important to try to manage your stress as best you can. So the ways to do that, I think, number one, we need to arm ourselves with good information. So you guys are already doing that. You're reaching out to experts, to doctors, to ask your questions, and really make sure that you know what the real information is. The second step is to protect yourself and to make sure that you're taking the steps you can to keep yourself safe and healthy. So like we talked about, wearing our masks, washing hands, avoiding getting close with a lot of other people. And the last thing is to really just directly practice being de-stressed. So things that work well is learning how to do some deep breathing or meditating, even laughter and having a good mood. So, telling jokes, watching funny movies, that type of thing can be really helpful in lowering our stress and keeping us healthier.
So can you give us some tips about how to avoid all the junk food?
Okay. So, I think the important thing, especially in the holiday season, is to make choices. And so if you're around, having people, having a little holiday get together with your family at home, try to choose healthier options of snacks to put out as opposed to the junk food, maybe some nuts and some fresh fruit, those types of choices. Maybe, little hummus and, pita chips as opposed to like having just chip after chip and candy after candy. Obviously, we don't want to have no candy ever. And that's, you have to live and enjoy a little bit. So, but trying to limit yourself to just a little bit at a day, as opposed to kind of eating tons and tons of candy. And the other thing is important to kind of balance. So if you're eating something that has lots of sugar in it, to try to balance that with a healthy fat or something with fiber to try to make it slower for your body to digest. So you're not getting as much of a blood sugar spike from that sugar, and things kind of are absorbed more slowly and easier for your body.
So you talked about stress. Kids are dealing with a lot of stress because of all the negativity and the fear in the news. How can kids learn to lower this stress and help their bodies go from fight and flight to rest and digest?
Yes. So it's important to make sure that we are armed with the right knowledge and that we're not getting scared and stressed about things that aren't true. I know sometimes we hear, on the news or on social media, people will make claims that are sensationalist and not necessarily true. And so I think the first step is to make sure that the reason that we're anxious is a real reason to worry about and not, something that someone just made up without any proof. And then we try to take steps to avoid getting sick or avoid, becoming, subject to this fear or this anxiety, but then kind of working on learning how to meditate, taking some time to do some deep breathing. Sometimes lavender essential oil kind of on your pillowcase at night can kind of give you that lavender relaxing smell. And just being with your family can be helpful. Being with your family, telling just stories, playing a board game together, that real social interaction that, is so hard to come by these days, can be really helpful. And one other thing that I forgot to mention is being outside. If you have access to some outdoor space, or even better, kind of in the wilderness, if you can, take a day and go to a wilderness kind of area, a park, and just spend some time in nature, that can really help to calm down stress hormones and help people feel much more calm and much more centered and grounded.
Yeah, we love to go on hikes, right, Zen?
Yeah, we love to.
Now let's talk about the elephant in the room.
Why are we all remote learning?
Yeah, we want to go back to school.
Of course. Remote learning is really hard. Remote learning is very challenging for everybody. And I applaud your, working at it and learning this way. The reason we're remote learning is because of the nature of how COVID infection spreads. Like I said, a lot of kids have very mild symptoms when they're sick. And a lot of times they don't have any symptoms at all. So they might feel perfectly fine, 100% normal, but still might have COVID infection that can spread to other people. Even in cases where people do develop symptoms, you can spread the illness 2 days before you start to show those symptoms. And so even well-meaning families that are trying to do the right thing and are feeling great might have COVID and not know it and spread it to other people, and make other people sick. So since we can't tell by how we're feeling and we can't test everybody every single day, that doesn't make sense either. The safest thing to do is to prevent people from getting together, kind of assuming that everyone might be transmitting COVID without knowing it. And so the safest thing is really to keep everyone in their own house, to learn remotely so that there's no chance of kind of spreading it amongst each other. And hopefully soon this will do enough to kind of curb the outbreak, and back in the fall, you'll be back to school.
So we are working really hard to try not getting this virus. But if a kid does get the virus, what can they do to become more resilient or help our bodies and cells cope and recover rapidly and completely?
Sure. So a couple of things that you can do. Obviously, we're going to want to keep on eating lots of healthy foods, drinking lots of water to stay hydrated, getting the rest you need to recover. But additionally, I would recommend supplementing a little bit with maybe some vitamin C and vitamin D. These are great antioxidants. The vitamin C is a great antioxidant, and vitamin D is a vitamin that really helps boost your immune system function. And zinc is another one that can really help your body fight off infection and keep your immune system strong. So trying to use those when you can, when you're sick, might help a bit.
We love vitamin D. And vitamin D, we actually make vitamin C lemonade.
Amazing.
Yeah. Are there signs and symptoms one should look for when they need to call their doctor?
Yeah, absolutely. So it's important to call your doctor if your cough is turning into trouble breathing, or you're developing chest pain that doesn't go away, very quickly, like a persistent chest pain, or if all of a sudden you're feeling excessively sleepy and can't really wake up, or, is kind of groggy and confused, like that's not good. That's not normal. Or if you're noticing any bluish color, on your face or on your lips, like those are all big concerns that you'd want to go right to the doctor.
Now let's talk about fevers. A fever is your body's natural response to infection. It actually slows germs down and increases our immune system's ability to fight infections. But a lot of parents get scared when their kid gets a fever. Should they be scared?
No, they don't have to be scared. I mean, obviously, the fever is an indicator that something's going on in your body. Your body is mounting this fever because of a reason. And so it makes you think, like, why is there a fever happening? But the fever itself is not dangerous. Yes, it can make you feel pretty crummy and icky all over. And in some cases with small children, it can cause someone to have a seizure. But even a seizure from a fever isn't going to cause brain damage. It's not going to cause long-term problems. It's just, your body mounting this fever to, like you said, stop the growth of the infection and help your immune system function a little bit better. But it can be scary to have these high fevers and, feel those effects.
So having a fever is good.
It can be good. The problem with a fever is sometimes it can be a little higher than it needs to be. And sometimes the side effects of that fever, like the feeling really gross and icky and sick, can make you not want to be able to drink fluids or to stay hydrated. And that's going to be a problem. You obviously need to be able to keep drinking fluids, and so your body can still function well. And so if the fever is so bad that you are feeling terrible and can't do what you need to do to help your body recover, then I think it's a little bit out of hand, and we can talk about what we can do to bring that down.
So when do you need to actually treat it?
So I would treat it not based on the number that you're getting on the thermometer, but more of how you're looking or how your child's looking. Some kids have 102 fever and they're running around and happy and playing, and, it doesn't seem to bother them, and fine, you don't have to treat it. Let the body, do what it needs to do to fight off that infection. But other times, even if the number on the thermometer looks lower, you can tell, like, your child doesn't feel great and they're lying on the couch and just miserable, then I would treat it, because you don't need to excessively suffer from the fever when there's other things, you can do to help, and in ways when having that fever is actually hurting your body's ability to fight off the infection and get better.
So what are the problems with medications that lower the fever?
So, all medications have the risk for side effects. The fever reducers that are NSAIDs, these non-steroidal anti-inflammatory medicines, so those are things like ibuprofen or Advil or Motrin. These can irritate your stomach lining if you don't take them with food. So especially in someone who's feeling really sick and doesn't want to eat or drink anything, taking these medicines can really irritate their stomach and give them stomach pain and stomach, discomfort. The other thing with these medicines is sometimes people will become allergic to them, and you can get bad rashes on the skin, and then can't take them ever again. So, we want to be careful when we're taking these medicines. The other common type of fever reducer is a medicine like acetaminophen or paracetamol or Tylenol, like these types of medicines. And these ones are gentler on the stomach, so you can take them without any food in your stomach. But they can damage the liver if you take too high of a dose, which that rarely happens, accidentally, but it's important to know. So for people who have any kind of liver damage, or, their liver is not working as well as it should, they might want to avoid using Tylenol medicines. And there's also studies linking Tylenol to worsening asthma if taken, for long periods of time. And so obviously we want to not use them if we don't have to.
What can parents do to naturally lower a fever?
So things they can do is they can try putting their child in a cool bath, not ice cold, but a little bit cool. And sometimes that can be enough to help bring the temperature down to a more reasonable level. Another thing we can do is this a wet sock treatment, where you take a warm bath first, a nice warm bath, and then immediately get out and put on a pair of socks, cotton socks, and then cover it with thicker socks and bundle up and go to sleep. And having that cool water around your feet kind of helps cool down the blood as it circulates and helps you feel better by the morning. And other people like to use homeopathic medicines, which are very specific depending on the type of fever that someone has and what's associated with the fever. So there's different choices for different medications, but those can be really helpful, if used properly.
You talked about vitamin C and vitamin D. Are there any supplements kids can take that can help build immunity?
Yeah, absolutely. So we can start with the beginning of the alphabet. So vitamin A. So vitamin A can be really good to help maintain the integrity of your skin and mucous membranes. So all the barriers that separate the outside world from our insides. So the mucous membranes in your mouth and the lining of the stomach and the lining of the intestines, these all get strengthened with vitamin A. And when these barriers are not as strong as they need to be, then foreign invaders like bacteria and viruses can cross the border and make us sick. So making sure that we have a good amount of vitamin A can help keep those barriers strong to protect infections and infectious particles from kind of getting inside our body and making us sick. The other thing is vitamin A can be made by your body from beta carotene, which is found in carrots. But about a quarter of the population can't really make this conversion very easily. So it's important to take vitamin A directly so that, if you're one of those people that can't convert over from beta carotene, that you're still safe and you're still getting the right amount of vitamin A. Like we talked about with vitamin C, that's very important. That's been shown to be antibacterial and antiviral, and it improves your antibody levels. So all the cells that, help protect you against getting sick, vitamin C can help kind of boost up and improve. When they've done studies and they look at vitamin C levels during an infection, they find that the vitamin C levels drop down. And, that can show that when we're sick, we kind of use up our vitamin C stores. So it's more important, it's extra important to get extra vitamin C when we're sick to kind of make up for that deficit so that we're still able to have enough to get what we need done. And we talked a little bit about vitamin D and how that can kind of improve your immune function. Again, it works at various levels. It works on, T cells and on clearance of bacteria. And even studies show that people with enough vitamin D have less colds. So kind of just from a standpoint of catching colds, like vitamin D can protect you. And a couple other, non-vitamins that we might not think about are things like iron. So iron is a really common nutritional deficiency. And even if your iron's just a little bit low, it can impair your immune system from functioning properly. The caveat with iron is that when we're sick with infection, bacteria and viruses also like iron. So we need to make sure that we're not supplementing iron when we're actually sick with something, because we don't want to be inadvertently helping the bacteria too, right? So that's good to kind of make sure your iron levels are good before you get sick. And the last one I want to talk about is zinc. So zinc can also be really helpful. It works well with vitamin A that we mentioned before, and it helps protect our body against the free radical damage that can happen when our body is viciously fighting off these foreign invaders and trying to keep us healthy. And zinc also directly will promote destruction of like bacteria and microorganisms. So that's a super effective thing we can take.
You can get a lot of these vitamins and minerals through fruits, right?
Absolutely.
Is that why we need to make sure our diet is important?
You're absolutely right. You can get a lot of these from foods, and they're actually absorbed better from foods usually than they are from taking a supplement or a pill. So, trying to eat a rainbow assortment of vegetables and fruits is a great way to try to hit all the different phytochemicals and nutrients that you need from fruits and vegetables. And then making sure that we're getting good protein sources as well. So, if you're a family that eats meat proteins, having some chicken and some beef and some lamb, that can all be really helpful. If you're a family that doesn't eat meat proteins, then, it's a little more tricky to get these complete proteins, but it's important to make sure that we're, combining the right grains and like nut butters and things to make sure we are having complete protein so our bodies can function as well as they should.
What foods have iron in them?
So meats have iron, so especially dark meats. So red meat like Beef and lamb have a lot. White meat or like a poultry, like chicken, doesn't have as much, but of the parts of the chicken, dark meat chicken has more iron than white meat chicken. So like those drumsticks and thighs, those have more. And for non-meat, things like lentils, spinach, broccoli, these all have a lot of iron too.
Thank you so much, Dr. Tiff. I'm already starting to feel less stressed and more empowered. Yeah.
Excellent. Great.
Yeah. What is one thing you can do today to help your body optimize their immune system?
So I think the most important thing that we can do every day for our immune system is watching the foods we're putting into our body. So, we're eating every day, and the foods we eat is more than just energy for, playing and for going about our lives, but the food we eat is also information. So it can either trigger our body to become more inflamed and, a little bit less healthy, or the foods we eat can be providing the information to help our immune systems be strong and helping our bodies form good muscle and think clearer and kind of decrease the inflammation in our body. So like you said, it's really tricky at this time of year because everyone's a little bit stressed from COVID, and that obviously makes people want to crave those comfort foods that often aren't the healthiest choices. And also it's the holiday season, like you said. So people, are getting lots of presents of candy and cakes and things. And so it can be really tricky to navigate, what to do and what we should be eating versus what we feel like we want to eat. And the hard part is, when we do eat these junk foods, our bodies are so stimulated and get so excited that it makes us crave them even more. And so it becomes this vicious cycle where our hormones are telling us like, this is what we want to eat. And it can be really challenging to decide not to eat those things if that's kind of our routine and our habit. So I think finding ways where we can make healthier options. There's lots of recipes you can find that have healthier varieties of making cakes and things without the sugar and with using other things to make it a little bit of a healthier option. Because it's hard. Like we want to eat the foods that our bodies are craving, and at the same time, eating those things are just going to make us want to crave them more, and it kind of becomes this cycle and gets hard to break.
You are so empowering. Everyone, please make sure to follow Dr. Tiff on social media. You are so inspirational. Where can people learn more about you and your work?
Yeah, so thank you so much. It was a pleasure talking to you guys. You can find me at our website of integrativepediatricsandmedicine.com, or you can follow me on social media. I'm on Instagram at dr.tiffjumaily, as you can see below on your screen. And I'd love to chat if anyone has any further questions.
Thank you again, Dr. Tiff.
You're welcome. You're welcome. Happy holidays, guys, and stay safe.
You too. To recap, Dr. Tiff's optimizing your immune system is key to being resilient, meaning if you get sick, you can jump right back to feeling better faster. But that is if you take care of your body. Your body will take care of you. Kids are more stressed today than ever before. With so much fear and negativity in the world, it is important to focus on all the things that are going right in your life, not all the things that are going wrong in your life. In our house, we focus on gratitude daily, morning and night.
Managing stress can help to optimize your immune system. So we love to get in natural pray, deep breath, and meditate daily.
Limit or eliminate sugar, processed foods, artificial foods, junk foods, as these will only weaken your body and its immune system. Focus on real foods. Eat the rainbow with veggies, clean protein, and healthy fat. These foods will give your body the minerals it needs to make sure the immune system is working well.
Sleep is so important for our immune system. If you don't sleep, there's an increased risk of getting viruses. And our bodies and our brains need sleep to help build hormones fix what needs to be fixed, and lower inflammation. So make a sleep routine and stick to it.
Supplements like vitamin C and vitamin D can help optimize our immune system. So talk to your doctor to see what dosage would be better for you. Don't overtreat a fever. Fevers actually help our body get over the sickness faster. Every day is a new beginning. Make sure you make decisions that will help your immune system, not weaken your immune system. So, guys, you got this. We need to take care of our body so bodies can take care of us.
Wow, Dr. Tiff, that was amazing. I hope that has taken the fear and stress out of this time and replaced it with empowerment. Thank you so much for joining us today.
Thank you. It was great to be here.
It's our pleasure.
It's our pleasure.
Thank you.
Thank you everyone for tuning in. Until next time, I'm Zain Ansari.
And I'm Abdullah.
Follow my family and I on social media, Holistic Mom and D, and look out for my mom's book, The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease, and the amazing children's book we wrote together called Adam's Healing Adventures. So check it out on Amazon. Yay!
Remember, our bodies and our health is a huge blessing, and we need to take care of our bodies the best we know how. Join us next week or next year for another episode of the Holistic Kids Show, where kids are empowering kids.
Thank you, guys. This was amazing.